it's important to evaluate the whole face. We've kind of talked about that a little bit. If you're looking at the Eiffel Tower and you've never seen it before and you want to get a feel for what it looks like, you don't look at the map because it's not going to give you a perspective. Or you don't look at a close-up view and look at it so close that you don't feel for it. So you could get a better perspective by looking at the whole thing at the proper distance. So when you're evaluating faces, it's important you don't get so close that you're looking at what the patient's focusing on and miss the whole view of the patient. So you don't look far away in a stand-up view. You've got to have the proper perspective and look at the whole face. Because sometimes when you look at this girl, you realize when you look a little closer that it's actually not a girl. So it's just your whole eye has to be trained to see what you're trying to see. Now, we talked a little bit about this yesterday, and for me to make a renovation or restore a face, you have to be able to have double vision. And that first vision is to be able to see, for instance, the volume loss in third dimension. But then you've got to be able to demonstrate it to the patient. So if you can't demonstrate it to the patient, then that becomes difficult. And then this is, I think, the part I saw yesterday was quite a few were struggling with kind of what they were trying to accomplish and what they were trying to create. So I think you have to be able to see in third dimension the end result before you start. And sometimes it's hard. That's why I ask patients whether they can draw and paint, whether they're artsy or not, because those patients make great patients. And they can see it so easily, whereas others can't. So that transformation, you want to be able to see that transformation before you start. You want to be able to see what it looks like. Now, men, we have an increasing number of men as patients, but men are a different breed. I have lots of professional men that I walk in the room, they're standing up pacing the floor with their BlackBerry and their iPhone, and they're reading the Wall Street Journal, and they're restless, and they're impulsive. So they do things aesthetically almost like buying a car. It's impulsive kind of thing. So you have to understand where men are coming from. Men go through different stages in their life. So treating men is different than women. But the aesthetic market is amazing. They are the new contre-couture. They are definitely have disposable income, the ones I see. And they've realized intuitively that the job market's a youthful arena. So they want to look better, but they don't want to look done. But there's 4 stages that men go through. So you understand those stages. You got that man in, whatever stage he's at, then you have to understand that. But treating the whole face, you think the patients would understand that it's not just like putting parts on. You don't put a cheek on or put a chin on or put the lips on. You want to have them understand it's about the whole face. So this is the phenomena that happens that I see every day and you see every day, but sometimes your eye doesn't see it or your brain doesn't see it. And that's when you smile, your eyes almost close. And it's patients often comment that they don't get the comments they used to get about how good they look because this is an old feature. This is a feature of aging. When you get older, when you smile, your eyes close, especially if you're an eye smiler. If you're a mouth smiler, it's not as interesting. But when you smile from your eyes, you get crow's feet at 15 kind of thing because it starts early. So the way you correct that, so any suggestions for how you correct that? There's mics at every one, and there's not a right or a wrong answer. It's just some suggestions of what you would do. Use the mic.
Well, besides the obvious neuromodulator, actually making the patient aware of it so that they can try and smile more with their mouth and not so much with their eyes.
I think that's the first part I like. The second part is impossible because patients, if you say smile, don't smile so much or smile different, they just live their life and they just carry on with their tics and their habits and annoying things that we all do. So they're not going to change that. So I think neuromodulator is a given. So what else?
Lift the brow.
Lift the brow. So shape the brow. The brow at her age,
Right
the brow needs to be a little strut work and a little support. And right here, this area here is she's a thinker, concentrating, squinting. It's created those fixed creases. And then what about her eyelids?
I like to put a tiny drop
in the mid-pupillary line, and I think it really opens that eye more. So instead of getting that squinty look right underneath the eye,
okay, I do that
really
too.
Opens it up beautifully.
But I'll show you one other advancement from that you can do. But that's very good. Okay, so I'm an eyelid guy, so I actually did her blepharoplasty, as well as lifted her brows subtly, just stabilized her brows, and my popular here. You don't want to make this too much, but just enough to smooth it out. And so as she smiles, you want to take the lines away. I think we've learned that the patients still want their smile, but they want to actually have a little bit of animation, but not the same as it was before, so it's obvious. And you can tell she's smiling the same by this zone here. And I've also treated some of these lines. But one other thing I did, and I can show you this with the concept here. We think of dentistry as a smile makeover, but if you look at our clinics, the reason I have so many gummy smile patients is because I talk them into having a spontaneous smile. Because if you have a guarded smile or a smirk like Joe Biden, or if you have a sort of an unusual smile, you don't expose the gummy smile. So there's a spontaneous smile, posed smile, embarrassed smile, feigned smile, polite social smile, which is what most patients give you when you're taking their picture, is just a kind of a polite smile, like you're smiling at the kids at a political event convention. And that full vermilion lip is normal, like this girl, and having slight asymmetry is normal, and the maxillary teeth showing is normal. And that youth amplitude, because the interlabial height changes with age. So if you can improve that, it's like the palpebral fissure of the eye, you can actually make it better as well. So that whole dynamic significance of the smile becomes obvious. And this is one of the reasons I try to do the same type of smile. And you can see this interlabial distance gets narrower and longer horizontal. So if you can improve that with your project, then that's one thing you can make a big difference. So we talked about this yesterday, the orbicularis oculi muscle. It's important to understand that constrictor part, because I think that's what you're hinting at, Christine, is that if you actually inject tiny units there, the constrictor, you can make the eye appear more open. So that's what I did to that first patient as well, to make the eye more open. And you do that by little tiny droplets. We showed this yesterday, so we won't get too fancy here, but I usually use a half unit here, a half unit here, right on the pretarsal part of the lid, the preseptal part, and that location. So if you want that diagram, I'll be glad to give it to you. But be really, really careful unless you're experienced. And I showed this girl yesterday as well, but I just wanted to show you a couple of more things about this. So this gummy smile is usually acceptable because it's so common, but it's so poorly treated because of misunderstanding about it. So the gummy smile sometimes is distracting and sometimes it's not distracting. Here it's distracting, here it's distracting. Her, you shouldn't get away with it because she's got such good phi. And lots of people have gummy smiles, from Tom Cruise to Julia Roberts. It's a common thing. So if you look at all the gummy smiles, you'll see them all over the place. These are all my patients with gummy smiles, and I've treated pretty well all of them. Now, the two types, quickly, you should understand, because they are treated totally different. One is the Venetian blind type. We'll back up here a little bit. So the Venetian blind is one that raises up, and the roll-up blind is the other one. So this is a roll-up blind, where the lip actually everts underneath, and this one is just the lip raises up. So any suggestions on how you treat each type? Anybody want to be gutsy and have a guess? I'm not saying the amount of units, but just where. The levator has and we see these to confuse the matter. We have patients that have a combination ones. So in this roll-up blind type, you want to just treat the orbicularis oris muscle and not the levator. The levator that lifts it up doesn't work well at all. You keep struggling with it, and it just won't lift. It won't relax. So this is the typical Venetian blind, and your injections are up here, not in the lip. So injections are where the levator is. So if you study out where the muscles are, then it helps you. So what happens is is you end up with just a nicer smile because it's more pleasant. So, and you can change patients significantly by their opening their palpebral fissure of their eye and changing the gummy show, and just without even doing much in the way of fillers, and just having a much more pleasant, youthful look. Quick question. How many units are you talking about? Half a unit. If you're doing the Venetian blind type, it's usually 1 or 2 units in the levator. And if I'm doing across the lip, I usually use 4 sites, a half unit each. Usually use 2 units for the levator, and for the orbicularis oris, I use 4 different sites. I think it's actually on here. We'll get to that quickly here, but usually the levator is here, and you use 2 units on each side is enough, and I'll usually use a half unit here, half. Sometimes 5 spots there, 1 in the middle as well, and just in the middle of the lip, right in the orbicularis muscle. I have some sketches all on that if anyone's interested in that, but it's a really nice concept, but it changes. You have to be careful because I inherit patients that can't suck through a straw after they've been having Botox in their lip for whatever reason. It's usually not gummy show. People are using Botox for wrinkles. It doesn't really work that well for wrinkles. It works okay for pursing of the lip. So this is typical of what we all see. So it's a girl in her 50s, and so what are the issues here with this girl? Just quickly. What do you see? Now I realize we're looking at 2-dimensional photos, but at the same time, you should still be able to see some issues here.
Malar flattening?
Yes. Okay, keep going on.
Yeah, temple to
start at the top. Start at her brows. So what about her brows? I mean, these are old brows. You can see this in a young adult, but her brows have no shape. Okay? And what about her laxity here? So she's got orbital hollowing for a number of reasons, including festoons a little bit here, but she also has some orbital hollowing and flattening of the cheeks. She's lost the sub-malar part of her cheek and the apex a little bit as well. Okay, keep going. Obvious here. I mean, these are obvious things. What about her chin? So her chin's fairly flat. So what I often, for this, you can just convert the photo just for your interest and see where the shadows are, and it helps you understand the shadows. But if you look and see where those are, you can see her brow is an older type of brow. It's distracting. You just don't like it. She's got that orbital hollowing, and the cheek is deflated, and the lateral commissure is looking older. And then look at her tail of her parotid. See the tail of her parotid? And what's this zone here? Post-jowl sulcus, and then the pre-jowl sulcus, and her chin's flat. I mean, it's just really flattened right out. So the tail of the parotid, post-jowl and pre-jowl sulcus, and her chin. So, and she's also got some platysma muscle. No, she hasn't got a submandibular gland there. No, that's just her bony part of it, and a little fat here, part of her jaw. So what we do is try to smooth that out. So that's 6 weeks later after 1 treatment session. So in trying to give her a smoother, softer look. So if you look at what we did, we just got the peak back in the brow just as we were measuring with Jamie. So lift the brow a tiny bit and then get the peak brow. I've had lots of questions on what I use for brows. Well, it depends on age group, depends on whether they have any shape or not. I have lots of hairless brows in my clinic, and if there's no structure between the forehead and the eyelid, then you want to use something like Perlane or Voluma that's got a little structure to it, a little G1 prime that you can lift. So if it's a very fine featured patient, then you want to use something that's a little lighter. I use Volift in Canada, or I'll use Restylane because it's smoother and you can blend it easier. So then the next step here is her jaw angle. So I use 5 units of neuromodulator here, Botox equivalent, whatever you're using for your neuromodulator. And then her pre-jowl, post-jowl, we inject with a good G1 prime. So I'll use Voluma or Perlane is what I use. If I'm being asked what I use, that's what I use. And the little trick in these corners of the mouth is, and it's hard to show you, I've got videos on that, but I actually, after you inject and reflate, because this is reflation, not inflation, I do the mentalis last. We do the pre-jowl sulcus and get a foundation here. And then that marionette zone, lift it right up sub-Q, because you can't get on periosteum there, in the corner of the mouth, and then get above the red of the lip. These are all vertical injections, and you lift actually that lateral commissure, lift it up and deposit small amounts of product, and it's just like an elastic band. It just goes spoing, that whole corner lifts up. It's quite dramatic, but I've never seen it written anywhere. I've never seen it demonstrated, but there's a few of us in Canada who do this, and it's a little technique. You lift that corner up and inject the product. So we may be able to demonstrate that with some of the videos. So, and then that whole face, as Jody was trying to show with some of those patients, that whole face is lifted. So you get a much more youthful look, because the way you're injecting, you're trying to create lift. So you're not only lifting and filling, as we tried to show with our fillers, but you're trying to recreate that youthful appearance that has that structure to it, and they stay. And one of the reasons I stopped using Sculptra is because Sculptra only lasts 2 years. And I can get Perlane or Voluma. We've used Voluma for 6 years in Canada. I can get it to last 2 or 3 years in cheek. I have lots of patients that come in that don't eat anything because it stimulates collagen. There's not much movement in a cheek. And so to me, for Sculptra, I see so many patients I inherit that, because it's a stimulator, not a volumizer. And it works here a little bit, it works there, and then the other side it doesn't work at all. And patients are very unhappy because it's uneven. So I use fine lines and with a cannula, and I use one injection point here and inject this way and inject this way and smooth it all out. But it's all done. You can if you don't have, which you'll have fine lines pretty quick with silk, but that's where I would use a blend, where I would use Restylane or something like that and blend it 1 to 1/2 or 1 to 1/4, which is normal saline. I don't blend it with xylocaine. Okay, and then your shadows look much better. So this is typical of what we all see as well. Really a girl that's she's beautiful. She's got terrible self-esteem. She's divorced. She's got a 20-year-old daughter that's got anorexia. She won't look in the mirror, and she's a former model, and she is absolutely stunning. I love her to death. She's just fantastic, but she's just the typical, and these patients will tell you that. I don't know what's wrong with me, but I don't get the comments. But she's still beautiful. But there's some subtle things that aren't right. Some subtle things that you can do that make a big difference. So in these 5 patients, her phi is just a little off. So what's not right here? What is it?
She has quite a bit of volume loss in her forehead because her
little bit
projects out.
Yeah, just a little bit. Mm-hmm. Yeah, I agree. She's got a little bit there. Pardon me? She just squared off a little bit. Yeah. I wouldn't touch her lips personally because I think her lips are great. A little bit of flattening her cheeks.
Flattening in her cheeks.
Mm-hmm.
Dr.
Okay, start at the top.
Asymmetry in her right brow.
Yeah, a little bit, but her brows too high or too low? Too high. Yeah. Way too high. They just look odd. It looks like she just looks like she's startled. But they're just too high. So you see the temporal fossa was deflated, and that area between her, the glabella area, is making her look older. This makes her look older and tired.
Okay.
And her eyebrow position, we'll show that in a minute. There's a little asymmetry, yes, but it's just a little bit off. And what about these? Her masseters. Masseters are huge, and so and her apex is actually quite good of her cheek, but her submalar part is hollow a little bit, and her tear trough. All a tear trough is the top end of that nasal jugular groove. I just happened to give that name of tear trough. So, I mean, these are subtle things, but if you could just make her look more youthful, then you really, all these are hiding in plain sight for all of us. But if you measure her and do all the phi, her brow is just too high. Everything else is just perfect. So all I did is shrink her masseters and lower her brow a little bit and do a little bit of fillers, and it just changes the whole persona. Just lowered her brows by about 2 millimeters. And you want to do your photographs so they're perfect, so you can line them up and compare apples to apples. Then you can have them be just right. And then it just looks much better. So this girl is an interesting character, and she's a quadragenarian as well. She's in her 40s, and came actually because of the girl just before, because she loved how she looked, just natural, and just looked so, it just brightened everything up. So what's this girl's issues here? Start at the top. There's no right or wrong answer. It's just there's some that are maybe fit better, but
Her brows are very flat.
What's flat?
Her brows.
Her brow really flat. Okay. Brows are really flat. So she's got a feminine face, but it's flatter brows make women appear masculine. So they got flatter brows. Okay, keep going.
Long forehead.
Yeah, it is long actually. By measurement, it is long, so it's a little distracting. Okay.
Her temples are hollow.
A little bit. Yeah. Exactly.
Masseters.
Yeah. Absolutely. It's giving her a little distracting look. Okay, what about this? Your nose. Okay. And her nose angle is off as well. And the corner of her mouth is droopy. So we used to call that pouty look. That's your parents used to call that. Now we call it a sulky look. Now we call it a grumpy look. So it makes patients look a little grumpy. Okay, so her brows are a little flat. Everybody picked up on that. And see her three-quarter view and the front-on view is matched perfect. So you can do all your drawings to make everything so your eye likes it. Okay, and we look, and she's got a little bit of nasal jugal here and her submalar part of her cheek and her lateral commissure. I mean, these are all little things, but I'll show you what little things make a big difference. So her masseters, we've already picked up on that, and her nose is wonky. It just looks odd, and she's got baggy upper eyelids. It makes her look tired. Okay, and that medial part of the head of the brow and the glabella is just a little sunken. It's yelling. They got miles on her. So same girl. Why did she do this to her hair? Speak up in the microphone there.
Because she doesn't want people to know that she had
Exactly
injectables.
right. Yeah, she just did that because she didn't want people to know that she had anything done, even though you can't really see what's done. So if you look, that is actually the same circle. Sometimes you look at photos and you say, well, maybe that's drawn bigger. But it's the same, exactly the same one. So if you look at her three-quarter view, you can see all the little subtle things. I actually did her blepharoplasty as well and raised her brows about 3 millimeters. And also did something else here. So the angle of her nose was too low. So I actually injected her right on top of the nasal spine and lifted up her nose a little bit. Lifted up the corner of her mouth a little bit. So everything looks smooth. And her maintenance has been practically zero. I've hardly done any maintenance with this girl at all. So the apex of the cheek was fine. It was just below the apex that was the issue. Okay? So those are all the little subtle things. So now everything matches better. Mathematically, she just looks much better. So if you look at in your syllabus, you've got that detailed anatomy we've been working on for a few years of injector's anatomy of the nose, all those things you should be aware of. And then we've also worked a lot at this nasal frontal angle and the nasal labial angle, which is the angle between the columella and the lip. And that little zone becomes important in trying to refine the face. And this distance that you're learning about, that distance of the nose is phi from the corner from the intercanthal distance. So that relationship becomes really important. All those things become critical. And her nose is not that great. She's a patient of mine that won Miss Canada here a 3 or 4 years ago, but her nose is a little off. So the ideal nose has this configuration with that. I think Jody was drawing this yesterday too, that nice brow tip aesthetic line. And you'll see how I use that a lot with these. So the profile is when you can measure this angle. So in men, it's not as acute, but this obtuse angle is usually 95 to 105 degrees as you measure it. I actually have developed a caliper now I use that we measure. Jody has one of the few prototypes there. So it's a fun one to measure. With time and genetics. So here's how I do the nasal tip lift. That happen to us on the planet Earth. The columella retracts. So as it retracts, if you look at photos when she's younger, her nose would be about like this. It's 95 to 105 degrees. So now it's more like 80 degrees. So we want to lift this nose up. And she's been quite aware that her nose tip is tipping down. So that's influenced by animation. Just open your eyes and just say January, February, March.
January, February,
March. Nice little smile. Okay. And then say it's cold out.
It's cold.
And see, it was cold too. It's minus 30. So you do a little tiny bit of neuromodulator, say 2 units of Botox at the depressor septi here as well, and it relaxes that pulling plus some Voluma. So it's a combination of both. This is 2 unit per 0.1 ml of Botox, and we use just 2 units here. A little prick here, dear. And if you're just a little careful, this is where you'll have to watch. They hardly feel a thing, patients really. Notice that we see it, but sometimes some patients are more sensitive, but there's just a little trick to it. So a little prick. I usually go a little lower on most patients than that. And the spine right on the nasal spine. You can touch it. And this is one of those little minis, so you can inject Voluma real easy or Perlane, something heavy. About 0.15 or 0.2. And it's one of the more dramatic things we do. And that just lifted that nose just lift that right up to about 95 to 105. So it just gives a much more feminine nose. There's really no side effects. There's no vessels there at all. So this is a little girl that ran for Miss Philippines a few years ago. She actually was my nurse. And she looks a little Cantonese, but she's actually Filipino. And what do you see that we might improve on this Miss Perfect here? Yeah, there's a little bit. Her brows, she's maybe raising them a little bit with the photo too, so one brow's a little higher. And a little bit. And it's a little unfair because the bridge of her nose is, you don't see so much, but it's right flat. She has a hard time wearing glasses. But I've done 2 plastic surgeons recently in my clinic that are both Cantonese, different parts of Canada, that had a hard time wearing magnifying loupes because they couldn't keep the glasses on. So we did fillers there for them. So when you're doing fillers here, you want to get that nice curvy linear line to look more feminine, and just gives an optical illusion that makes her face look narrower. But all I've done is a few little things here, but we just narrowed this a little bit and give this whole curvy linear line a better look here. So that just improves the whole structure there. And that's where I inject. And also she's got large masseters. So we inject her masseters to give her a more refined face, much more feminine look. Now, we're probably out of time right now, aren't we? Where's Bob?
No, we're fine. We're good. Keep going.
Are we good?
Yep.
Because these get a little bit more complicated, but they're of interest. So this girl, if we look at her normal view, is the middle one. And then this is 2 rights and 2 lefts. Sometimes helps you see what's happening to her face here a little bit. So she's in her 40s and had a motor vehicle accident when she was a child and injured the right 7th nerve. So she has paralysis of that right 7th nerve. So the left side has some dyskinesias and synkinesias. It overreacts and it lifts up and misbehaves a bit. So when you look at all her animated views here, you can kind of see, so you can tell me what I should do with this girl. Okay, to make her look more youthful, because she's getting lots of unpleasant comments from others, because she just moved to our city. Okay. So what are we going to do here? She's not on a budget, so you could just go ahead.
I would focus
you just go wild.
I would focus on her right eyebrow, putting some filler there just to kind of give her more of a lift and more support.
Uh-huh.
And then definitely neuromodulators in her left forehead and brow.
Excellent.
And then she needs some volume in her tear trough area and her right cheek.
Okay. All right.
And temples bilaterally need some volume.
Very good. Christine, you're awake today. That's very good. That's good. Okay. Keep going.
And then she needs some help with her myelolabial crease there. Some volume.
Yeah. Well, she's got post-acne scar here. So what are you going to do with all these post-acne scars?
Well, you could do some subcision when you've got your needle in there right away. You can do some microneedling, filler, of course.
Okay, that's not working on her, so what else are you going to use?
What else am I going to use?
Yeah. If you're not limited by devices.
Lasers.
Okay, what kind of laser would you use?
Probably CO2 or fractionated.
Yeah, I'd use fractionated because if you're going to use Erbium-YAG or CO2 kind of resurfacing here, you're going to have to bevel it all down. So fractionated. So I use fractionated. I use Deep Effects or I don't like Erbium-YAG fractionated lasers for acne scars because you have to get too assertive and they bleed too much. So I think that works well. So anybody use fractionated lasers for acne scars?
I do.
Yeah, it's amazing as long as you have the steps in order. And that's where we use the blend. After we get them all where the collagen is stimulated and loosened up, then you can use cannulas on these.
Dr. Remington, I have a question for you.
Mm-hmm.
On her right eye, beneath, it appears that she has some type of interference, maybe with lymphatic drainage.
That's called fat.
That is, it's a herniated fat.
That's a herniated fat pad, right? Fat. Okay. So let's just look at these. Okay, who got a question there?
I was just going to say on her motion photos, you can hit those sympathetic junctions where the muscles are doing what they're not supposed to do also, because I've done that for post-ball palsy patients.
Right. Yeah, that's basically, in her case, it's not bells, but it's light bells. It's just her upper seventh nerve here is overreacting. So Christine's suggestion, whoever suggested that as well, as long as with Christine that you'd relax that as well. So we've got that facial asymmetry that's pretty impressive. And her hollowing is pointed out by several of you. And that facial asymmetry with animation without just even being relaxed. And all those things in that perioral soft tissue scars. I mean, this is where you have to have a plan. So you say, okay, step 1, step 2, step 3. Because you're not going to do a home run on visit 1. So her upper eyelid issues there. So she's got her eyebrows raised a little bit there just in the camera. So we did a blepharoplasty on both sides, but less on the left side. So you have to do a little teeter-totter balance. And then neuromodulator as well, and then fillers. And then those are the sites that I did her neuromodulator, all in red. And then her fillers as well. And 6 weeks after her second Deep Effects, then we started doing fillers to lift this. And now she can, when she wears makeup, then she can cover that because we got balanced and harmony and everything else back into her face. So here's a girl that, I'm sorry we got the after picture on here, but this is a girl that comes in for something else. And while she's there, she's a sweet girl, but it's very distracting because she's got those brows that came from some space movie, and they're just distracting. So we have a little visit about these brows, and we change their shape. And sometimes you have to use tattoo laser removal and teach her where to put that brow, head of the brow. So you get that head of the brow back, and she was very receptive to that. And there's ways to add product to create a narrower face. So you can add product, neuromodulator, and filler to create the illusion of a narrower face. So when you're doing the nose, and you do this measurements like we've been talking about, you get that nose lifted, And also the tip of the nose. You can raise that up as well. Then you just get it. And your eye likes it better. It's just, and she loved it. She was at first incommunicative, but now she sent several of her friends. She's a great little patient. So here's a girl that comes in with her husband and her daughter and says she needs a facelift but does not want surgery. So in patients like this that just do not want surgery, then they are a challenge. She's had an upper bleph before. She's had repeated Juvederm injections with little chasing lines here and there. So what are you going to do with this girl? No, and we're not on a budget, so you just take the budget out of your... So how much are you going to be able to improve her? I tell patients like this, she's 60, very intense girl, and she's very pleasant, but she's got bad face DNA. So we're just not going to make... I said, we're going to probably make you 50% better. What does 50% better mean? I think you have to explain to patients, because a lot of patients think 50% better means 100% better, and they're going to go out looking like they're 40 again. So what are your ideas? What would you kind of do to this girl? I mean, this is an everyday... We all see these patients every day. And her brows are really, really flat, and they're uneven, very symmetrical, so your eye doesn't like that. Okay? Cheeks are flat, right? Here. And this is what's catching your eye, this lower face. These fixed lines and creases, they're like taking that hem down your pants we talked about. These are traditionally very difficult, but now we have a way. Now we have a way of treating these without laser. I mean, you can laser these, yes, but in a patient that's adamant they're not having any surgery and you've done all your flipnosis, this is the same patient. And there's no surgery. There's no laser. This is all just fillers and doing my mesomix here. And breaking those off fairly assertive. So you can just make her look, and she happy with that? Absolutely thrilled, even though it's far from perfect. But she looks now acceptable, and now with the makeup, it looks... And also, as Jody was... Hang on here a minute. As Jody was pointing out, this is always a good place to look as well, because you can see that cheek elevation there from the three-quarter view. And so what was the questions?
How many syringes did you use for her?
How big a syringe do you want to talk about? You mean how many 1cc syringes? Yes. I'd have to look at my chart. I probably used about 8. About 8. Remember, it takes 15 syringes to make a tablespoon. But we use either fine lines, Restylane fine lines, Restylane Classic, or I'll use Volift, what it's called in Canada. Those are my 3 favorite for this. And a cannula, I don't use 30 gauge cannulas. I usually use 27 gauge because they're less whippy. And I'll use usually 2-inch ones here rather than 1.5 inches, and 1 starting point here. And I'll show you the graphics here. And you don't need very much. You can do 1 cc on that whole part of her face here. But the idea is, I think we showed some patients yesterday, is you start here and you can do this a little bit as well, and you fan it out and break this up a little bit. It sounds like poppy bubble wrap. And they don't bruise. They hardly feel a thing. Patients it looks wicked if you've never seen it before, but they hardly feel a thing. And there's very minimal swelling.